Jewish communities, particularly Ashkenazi Jews, those of Central and Eastern European descent, have specific medical and genetic conditions that are more prevalent within their population. These conditions are often due to genetic factors, historical isolation, and cultural practices. While not every Jewish individual is affected, some conditions have a higher frequency in Jewish populations. Here are some of the key medical issues that are more common in Jewish communities. Several genetic conditions are more common among Ashkenazi Jews due to the relatively small gene pool and historical practices of endogamy, or marrying within the community. Tay-Sachs disease. What it is. Tay-Sachs is a fatal genetic disorder caused by the absence of an enzyme, hexosaminidase A, which leads to the accumulation of toxic substances in nerve cells. Prevalence. It is particularly common among Ashkenazi Jews, with a carrier rate of about 1 in 30. Affected children typically show symptoms in the first few months of life and often die by the age of 4. Gaucher disease. What it is. Gaucher disease is a genetic disorder where harmful quantities of a fatty substance accumulate in the spleen, liver, bones, and bone marrow. Prevalence. Ashkenazi Jews are at higher risk, with a carrier rate of about 1 in 15. There are 3 types, and while type 1 is most common in Ashkenazi Jews, it can be managed with enzyme replacement therapy. Cystic fibrosis. What it is. Cystic fibrosis is a genetic disorder that affects the lungs, pancreas, and other organs, leading to difficulty breathing and digestion problems. Prevalence. It is more common among Ashkenazi Jews compared to other populations. The carrier rate in Ashkenazi Jews is approximately 1 in 25. Bloom syndrome. What it is. Bloom syndrome is a rare genetic condition that leads to short stature, sun sensitivity, and increased risk of cancer and other health issues. Prevalence. It is more common in Ashkenazi Jews, with a carrier rate of 1 in 100. Fanconi anemia. What it is. A rare genetic disorder that leads to bone marrow failure, congenital abnormalities, and a higher risk of cancer. Prevalence. Ashkenazi Jews are at a higher risk with a carrier rate of approximately 1 in 90. Mucolipidosis. 4. What it is. A rare genetic disorder that leads to developmental delays, visual impairment, and neurological problems. Prevalence. More common in Ashkenazi Jews with an estimated carrier rate of 1 in 100. Michel's syndrome. What it is. Michel's syndrome is a genetic disorder that affects the inner ear and can cause hearing loss, and occasionally kidney or other organ issues. Prevalence. It occurs more frequently in Ashkenazi Jews. Certain types of cancer are more common in Jewish populations, particularly due to genetic mutations. Breast and ovarian cancer, BRCA1 and BRCA2 mutations. What it is. Mutations in the BRCA1 and BRCA2 genes increase the risk of breast, ovarian, and other cancers. Prevalence. Ashkenazi Jews have a higher prevalence of these mutations. About 1 in 40 Ashkenazi Jews carries a BRCA mutation, which is significantly higher than in the general population, about 1 in 400. These mutations are associated with an increased risk of breast and ovarian cancer in women, as well as prostate and other cancers in men. Genetic testing for BRCA mutations is common in Jewish communities, and early detection can help manage and reduce cancer risk through surveillance and preventive measures, such as prophylactic mastectomy or oophorectomy. Other cancers. While breast and ovarian cancers are the most well-known, Jews of Eastern European descent are also at an increased risk for other cancers, such as colon and pancreatic cancer, particularly if they carry certain genetic mutations. Hypertension or high blood pressure. Cardiovascular diseases, particularly high blood pressure, are common among Jewish populations, though this is largely influenced by lifestyle factors such as diet, stress, and obesity, and not solely genetics. Coronary artery disease. Ashkenazi Jews may have a higher risk of heart disease due to genetic predisposition as well as lifestyle factors. Rheumatoid arthritis. Jews, especially Ashkenazi Jews, have a slightly higher risk of autoimmune diseases like rheumatoid arthritis, where the immune system mistakenly attacks healthy tissues, causing joint inflammation. Systemic lupus erythematosus, or SLE, is more common in Jewish women compared to the general population. This autoimmune disease can cause inflammation in various parts of the body, including the skin, joints, kidneys, and heart. Celiac disease. Celiac disease, a condition where the ingestion of gluten triggers an immune response that damages the small intestine, is more common in Jewish populations, particularly in those of European descent. Schizophrenia studies have shown that Ashkenazi Jews have a slightly higher prevalence of schizophrenia, a severe mental illness characterized by delusions, hallucinations, and cognitive impairments. The reasons for this increased risk are not entirely clear, but may involve genetic factors. Bipolar disorder. Some studies suggest a higher prevalence of bipolar disorder in Jewish populations, possibly due to genetic predispositions. Depression. Mental health issues, including depression and anxiety, are common across all ethnicities, but some studies suggest higher rates among Jewish individuals, possibly due to historical trauma, social pressures, and cultural factors. Male infertility. Some studies suggest that Jewish men, particularly Ashkenazi Jews, may have a higher incidence of male infertility, though the causes remain unclear. Endometriosis. A condition in which the tissue that normally lines the uterus grows outside it, leading to pain and infertility, is more common among Jewish women than in other populations. Blood disorders. Jewish populations are at increased risk for certain blood disorders, including hereditary spherocytosis, which affects red blood cell shape and function, leading to anemia, jaundice, and splenomegaly. Thrombophilia, or blood clotting disorders. Some Jewish individuals are carriers of conditions like factor V Leiden or prothrombin gene mutation, which increase the risk of blood clots. While Jewish communities, particularly those of Ashkenazi descent, face a higher risk of certain genetic and health conditions, genetic testing, early screening, and awareness can significantly reduce the impact of these conditions. The high prevalence of genetic disorders like Tay-Sachs, Gaucher disease, and BRCA mutations underscores the importance of genetic counseling and testing, particularly for individuals of Jewish descent who are planning to have children. Furthermore, lifestyle factors and access to healthcare also play a significant role in managing these conditions.